Hi friends, thank you for tuning in to the Concussion Coach podcast. I'm Bethany Lewis, the Concussion Coach. I'm a neurological occupational therapist and certified life coach, and I specialize in guiding people through their concussion recovery journey. I am passionate about helping people understand their injury, speed up their recovery, and reclaim control over their life post-concussion. The purpose of this podcast is to help increase awareness of concussions and the impact they can have on a person's life, and to bring hope to people who have suffered a concussion and those who love them. I firmly believe that sharing stories and knowledge about concussions will bring important light and understanding to this misunderstood and often invisible injury. The information in this podcast is meant to bring that awareness and hope and is not meant as medical advice. The opinions shared are those of the interviewees and my own. If you are suffering with lingering concussion symptoms, I have created a concussion coaching program specifically for you. I will be your mentor to guide you through your recovery journey, offering help with understanding and managing your symptoms, setting achievable goals, and learning how to manage your own thoughts and nervous system in order to get control over your life again. If this program sounds like something that would help you or someone you love, sign up for a free consultation. In the consultation, you'll get valuable information and resources and gain hope for your future. Sign up for your free consultation at the link in the show notes or at my website, www.theconcussioncoach.com. Hi friends, welcome back to the Concussion Coach podcast. Before I introduce my guest today, I just wanted to make sure that you all know about the free guide that is available on my website. It's the 5 best ways to support your loved one dealing with a concussion. If you have a friend or family member who is struggling with post-concussion symptoms, or if you're the one struggling and would like your loved one to know more about what you're dealing with and going through and how they can help, please head over to my website, theconcussioncoach.com, and download the free guide. I'm excited for this conversation today. I get to speak to another occupational therapist who is passionate about helping people in the concussion space. And we were introduced by our mutual friend, Shannon Clark, who has also been on the podcast in the past and coaches people with PCS. So shout out to you, Shannon. Thanks for making this introduction. I really love the connections that I've made in this space and how much everybody just really wants to help people dealing with this injury. Like there's such a need and there are really good people working to fill it. So grateful. Meghan Schneider is an occupational therapist who works at a Rise Above Occupational Therapy Services, a private practice in Pennsylvania, where she primarily treats individuals with traumatic brain injuries. She holds a post-professional doctorate in occupational therapy from Elizabethtown College and serves as an adjunct professor there, teaching a range of advanced occupational therapy courses. As the co-owner of NeurOT Consulting, Meghan provides education and consultation to professionals and healthcare systems looking to develop or enhance comprehensive concussion programs through neurorehabilitation, vision, and interoception-based approaches. Meghan is a certified brain injury specialist and certified functional vision rehabilitation specialist. She's also the co-publisher of the on-demand course Interoception, Concussion, and Brain Injury, developed in collaboration with Kelly Mahler. Oh, is it Mahler or Mahler?
Mahler.
Mahler. So close. Okay. Kelly Mahler, which is the first and only course dedicated to the intersection of interoception and brain injury. In 2024, Meghan was honored with the Dan Keating Pioneer in Brain Injury Award from the Brain Injury Association of Pennsylvania for her groundbreaking work integrating interoception into brain injury rehab. She has presented her research nationally and internationally, sharing her expertise on interoception, self-regulation, and holistic recovery. A TBI survivor herself, Meghan brings a unique perspective and passion to her work, empowering others to better understand and connect with their internal experiences as part of the healing process. This is going to be such a good conversation. Thank you so much for being here, Meghan. I'm so excited.
Thank you for having me. Yeah, I'm looking forward to it.
Yeah, this is going to be good. So let's start with having you share how you became interested in occupational therapy and then what led you kind of into specifically helping people with traumatic brain injuries.
Yeah, so for me, it kind of started being surrounded by it growing up. So I had friends who were on the spectrum and had OTs constantly working with them. I had family members that had OTs coming into the, whether it's their house or they were going to OT outpatient clinics, whatever it might be, I was taking them. So I was surrounded by OT my whole life. So kind of a unique perspective. A lot of people, I think, don't know too much about OT or they just learn about it later. But for me, I was surrounded by it. And a lot of my family, they're actually all teachers. Majority of them are teachers, special education and things like that. So there was no doubt in my mind I would get into a helping profession for sure, because I was surrounded by it, whether just going to OT appointments or, through my family members and stuff. So when I started looking into careers, it was kind of easy for me. I initially thought I wanted to be a doctor, but I was eager to get out in the field and start helping people a lot sooner than having to go years and years of school. And just knowing how cool OT was and recognizing, as you get older, like, wow, OT can work in so many different fields. It's so cool. There's so much we can do. And I got to see the whole spectrum of, what OTs are able to do. I kind of knew it was for me. I loved it. I knew I wanted to help people, and it was creative. It was fun and right up my alley.
I love that. That's so awesome. Why don't you tell us, yeah, what brought you back into working with people with traumatic brain injury specifically?
Yeah, so then traumatic brain injury. I have experienced several in my life, and I was an athlete all my life, and then an athlete in college. So I've had my fair share of mostly concussions. So I kind of experienced all of the deficits related to what a TBI can bring, right? And so for me, I'm blessed. It was a mild traumatic brain injury, right? Just a concussion. So I'm very blessed in that sense. But I had been surrounded by plenty of other people who had different types of brain injuries, experienced different deficits, but also the same, just maybe different severity and things like that. Um, and so that's kind of what then got me into the field. I love neuro. I love the brain. I find it so fascinating, how it can change and heal itself. I think that is one of the most incredible things in the world. So that's what kind of led me then to TBI and the neuro end of things.
Okay, cool. So you knew going into it that you were interested in working in the neuro field.
Yeah, for the most part. I also love pediatrics because I had lots of cousins and family members, friends that were all little, and I always was hanging out with them. And part of actually the population, the other percent of the population I treat is pediatrics, and people oftentimes tell me like, well, how do you go back and forth between, concussion brain injury and pediatrics? And my answer is always it's the brain, right? So it's still neuro, whether we're talking pediatrics, kids with autism, kids with ADHD, sensory differences, it's all neuro. So a lot of it actually overlaps, and we find a lot of the skills I'm working on with both populations. So it's pretty neat. I absolutely love it and love the brain for that reason.
Yes, right. It is so fascinating, and I love that you get to work with two populations that you just really love. And there is overlap, like especially the whole primitive reflexes thing is so fascinating to me that
Mhm.
you can work on that with kids who haven't had them fully integrated yet in the first place, and then with traumatic brain injury, a lot of times those come back, and so you're working on reintegrating them. So it's like there are some things that you would be working on very similarly with both populations, I would imagine.
Absolutely.
So fascinating. So tell us a little bit about your own injury. I was going to say your injury, but it sounds like you've had multiple. What I guess most, and you don't have to dive in. I know it sounds like again, there's a few of them, so you can just kind of tell us what you want to from your experience of having brain injury yourself, and what was helpful in your recovery, and how does that kind of inform your current practice?
Yeah, so I'd say one of my worst ones was in 2022. Essentially, I fell, I cracked my head, fractured my skull in two spots, pretty significant concussion there. And something that really sparked my interest at that time, of course, I had already been working in the population and through other more minor concussions through high school and college, diagnosed or not diagnosed, right? I kind of had an idea of what it was like and was treating that and understood it. But it really wasn't until this pretty, no pun intended, traumatic event
Hmm.
that I really had a deeper understanding of what it was like to suffer with some of these symptoms, and then what post concussion syndrome also looked like right after the fact. Um, and so one of my favorite stories to kind of tell, just to give everybody a laugh to the sad situation, is when I was in the hospital. One of the doctors had come over to me, and of course, I just explained kind of what happened. And the doctor kindly but said to me, "Oh, we think you might have a concussion." And I almost lost it. I was like, "You think I have a concussion? I have every symptom in the book for a concussion. I fell and hit my head. Do you think I have a concussion?" And thankfully, that same doctor the next morning, he came in and he said, "Oh, I ended up looking you up, and yes, you probably know more about concussions than like any of us here. So I'm sorry, and we're going to educate our staff more. So thank you for kind of bringing that to light." So that was a nice aha moment for me. But that happened in another state, and so when I got back to where I lived and kind of had some time to process through that, I took some time off work, obviously, because I had a lot of the symptoms. um, there was like a gap in what I was experiencing and even what I was providing. So, right, we can provide so much as OTs. We have the unique ability to tackle so many areas that
Hmm.
someone's, experiencing deficits in from a concussion. And so one of the areas happened to be interoception, which I'll kind of get into later, what led me into integrating interoception and brain injury. But all of the symptoms that I had from that, right? The headaches, the trouble sleeping, the brain fog, the memory, the poor processing speed, the double vision, the blurry vision, you name it, I was textbook. I had everything. And so I really understood what patients were telling me when they were saying, you know, that feeling, it's not really like spinning, like dizzy, and I'm like, oh, woozy. And they're like, yes, how did you know that? And I'm like, oh, been there, done that, right? Or even understanding what it was like to go into work with like a 7 out of 10 headache for like a year. I did. Like I understood them. I really understood what they were going through. I could sympathize with them. I could empathize with them, you name it. We were a good match, me and a lot of my patients, because I was almost doing therapy on myself, trying to help them. And that's kind of what led me also to starting a support group. I host a support group on Tuesday nights at 5 o'clock for survivors, for caregivers, whoever it might be, whether it's in person if you're in Pennsylvania or Zoom. We also offer it. I can give you that link
Awesome.
if you're
Yes, please.
interested to post. And I run that just because I do. I still understand what it's like. I still have a few lingering symptoms here and there. I write everything down. My office is covered in post-it notes. But I also understood the benefit to therapy and could help to therapy myself. And thankfully, I was so blessed to be surrounded by so many incredible people then at that point too, working in the field for, a few years at that point. I had known doctors and good therapists and things like that. So thankfully I got better and had the resources right at the tip of my hands. But not everybody has that. It's kind of tricky. So just fueled my passion even farther.
Right? Yes, that is exactly. I'm like, I love that you had the resources and the ability to to get the help that you needed and you knew what you needed when you needed it. All of that is like golden. I don't know
Yeah.
anybody else who's had that experience. So
Yeah.
I
I'm
think
very
it's such
fortunate.
a good thing. And then I love that you're using that to fuel your passion to help people. And that's why we're doing this podcast. It's like we want to get as much good information for people so that they can decrease the
Yes.
amount of time that they're suffering unnecessarily as possible.
Yeah.
Um,
Absolutely.
yeah.
Absolutely.
So I'm just curious, what were some of the things that were most helpful for you in your recovery?
I think the biggest thing for me, and I kind of mentioned this, and it sounds a little bit silly, but being around people who understood. So while I was there being someone's therapist and I had my therapist hat on, understanding these people were having a 7 out of 10 headache, the same as me, and we could still kind of giggle about it. It makes you feel like you still belong despite having a brain injury, right? I'm not alone. There's still plenty of people like me, and there were people cycling day in and day out, every hour, every half an hour that were like me. So I truly do think that was the biggest help. In terms of a support system, I also have an extremely supportive husband, an extremely supportive extended group of family, my parents and my siblings and friends and stuff who are absolutely wonderful and still are to this day. And I think having someone like that in your corner all the time is truly incredible because people don't always get that. It's very hard. It's hard for people to understand if they haven't been through it, whether that's a good or bad thing. That a lot of my family were college athletes too and all had concussions, so they really get it. Not necessarily a good thing, right? But they understood, so they were with me through every walk of it. So that would be my number one contributing factor to healing, I would say. But in addition to that, like I said, I had everything at my fingertips. So we did vision remediation, which was incredible. So we do that at our office with optometrists. We do vision remediation, optometrist directed. So we had that. I could get into seeing an optometrist right away who gave me a diagnosis so I could work on these skills myself. So that was super helpful too. And then the interoception piece that I feel like nobody was touching on, which again fueled for me to kind of do what I do. But that was super helpful in terms of like my regulation and something that not a lot of people touch when it comes to concussion recovery. Tends to be something that's swept under the rug a little bit because it's not a physical symptom. So that was also very, very helpful for me.
Cool. I'm really excited to jump into that some more. But before I do, I just want to ask if there was anything from your personal experience, because you've been practicing before, you've had this concussion and PCS experience yourself, and then you continue practicing. Was there anything that you did differently after having experienced it yourself that that you are doing now because you learned it from your own personal experience?
Absolutely. I think the biggest thing was giving myself grace. So for some of my other concussions, and I still had post concussion syndrome after that, some of the earlier ones in my life, but never to the extent of like having every box checked off in terms of symptoms. And so I would be frustrated with myself. Why am I not getting better sooner? But that really, a lot of them only lasted, whether it was a few days or even just a few months, but this one was lasting a lot longer. And so it's harder to give yourself grace when you're not healing at the pace that you have healed at before or want to heal at. I wanted to get back and working full time so I could help more people and do more things. But you can't. And so with this one, I really learned if you don't give yourself grace and time to heal and be kind to yourself, it's not helping anybody. It's not helping yourself. It's not helping the people you live with, the people you're surrounded by, my patients. If I can't practice what I'm preaching, why the heck am I doing it?
Right.
So this concussion is past that most recent, well, not even the most recent one, but that one in 2022 really allowed me to take my time with things and say that healing is not in my time and it's going to happen. I will put in the work, but don't get upset if things aren't working and they're not perfect. And of course, that's easier said than done, but I definitely did a much better job at it this time and would preach that for anybody to give yourself grace.
And it sounds, I want to ask you how you did that, but I think you told us like the way that you chose to think about it, like healing will happen, but it's not in my time frame, but I trust that it will, and I'm going to keep working towards it. I'm guessing that's it. Is there any other like brilliant tips you have in how to give yourself grace through this?
No, I mean, honestly, for me, I'm a firm believer in it's God's time. Like I knew it would happen. It's going to be God's time. He's going to help me heal, but I also need to put in the work, right? So I need to help myself. I can't just expect to be helped, but I know I will heal. It's just not on my time. It's God's time. So almost talking yourself through it too, whether, you believe or not, just talking yourself through it's going to happen. Stay positive. But it's not going to happen overnight, and that's okay. And almost coming to terms with it's not going to happen overnight, right? So that's a big barrier you have to get through too. Just saying it's not going to happen overnight. It's not going to happen next week. It is going to take time. All research shows that. All anecdotal stories show that. Mm-hmm. So just accept that and then move on and do what you can from that. So it's very, very small baby steps to get there, but you will get there. It just takes time.
Yeah, that's beautifully said. Thank you so much. And do you feel like that it has happened? You are recovered to the degree that you feel appropriate? Like, how do you feel about it?
Absolutely. Certainly from that 2022 concussion. Unfortunately, I got in a car accident, but like March of this year. So that kind of re-sparked some of my symptoms. And of course, that's like very frustrating, right? I'm like, oh my gosh, I've been doing so good. And I was back to, the new 2.0. Sometimes we like to call that in the support group, like it's the Meghan 2.0, right? So you might not get back to being 100% of your old self, but you also age within that time process, right? So I tell people like, I'm not as good as a tennis player now as I was how many years ago in college, but that's not because I'm worse. It's just because I'm aging and I'm getting older. And so it's a 2.0 version of looking at yourself. Mm-hmm. And so that's kind of the perspective I took in terms of that.
Love that. Yes. And with that, the setback thing is something that I do feel is important to talk about because people hearing this are like this, it's a reality as part of this journey of recovery. Setbacks will happen. So you're making good progress, you're getting there, you're making 2.0, and then you get in a car accident and things slide backwards again. How do you deal with that emotionally? How was that experience for you? Because it sounds like it wasn't quote unquote as bad of a concussion as the previous one, but it'll bring back stuff. I'm sure there's a lot of fear. Like what was that like for you?
Oh yeah, no, absolutely. It brings everything back right away, right in that moment. So for me, I was like in the middle of a 5-car pileup. Wasn't my fault, right? I just got smashed from both ends. There was a lot of people involved. And so the first thing, I mean, you go through the phases of like healing, right? And grief too. Like I was super ticked. Like when it happened right away, I was like, you've got to be kidding me. And I remember like the officer knocking on my window and just sitting there because I knew to listen to my body. And this has happened to me before. I'm like telling him, I'm like, hold on a second. I just need to like check myself before I start moving around. Like, give me a second, please. And so you kind of go through that phase. I was upset and then I was sad. And then I kind of did that like all in one day. And then I think thankfully for me, the next day I woke up and I was like, all right, this happened. I think it's going to happen for the rest of our lives. Like, there are unfortunately those studies that show that people who have had concussions before were more susceptible to a small bump on the head or something like that to bring back symptoms. And I think just dealing with what you're dealt with and what you have to do rather than kind of, I don't want to say sulking in it because I went through my fair share of doing that too, like I said, right? But of course, having so many, I've learned to kind of flip that switch and it's different for everybody. But telling yourself, all right, it happened. It sucks. It really does suck. And I hate that this happened. But what I also tell people is to use that though, almost as ammunition then to help other people, to tell your story, to use it for the good. So every time I get another concussion and bump myself in the head, I'm like, all right, more fuel to keep going. How can we help more people? How can we, educate people further and get them more help? And so I also tell a lot of my patients to get involved somehow. And that has been super helpful for them. They absolutely love it, whether it's on the national, international, state level. They are absolutely loving that. So I kind of tell them to use that fuel and that energy that they have building up, whether it's anger or sadness, use it for something good. You can still, it's valid to feel those things, right? But use it for something good, advocate.
Oh my gosh. Yes, 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 to everything you just said. It gives meaning and purpose to the pain. And that is huge in allowing yourself to progress through it and from it. I really, really love that. And something I like to tell people too is like, you're right. The people who are listening, I hope that this doesn't like feel super discouraging. Oh crap, I might have more of these because I've had one
Right.
already. I totally get that.
Yep.
That can cause a lot of fear, and more
Sure.
anxiety about hitting the head or whatever. But I just really want to emphasize to people, and you're a perfect example, like you know now because of this experience you've already had, you know how to deal with this and what to do to get better. You're like so much further along than you were the first time it happened. And so like let that reassure you as well. Like you've been here, you know this, and you know what will help. And even if symptoms are different, because they can be different with different concussions, but there you know where to look for that help too. And that just it really makes a huge difference. So and
Absolutely.
and then I do really love that, like channeling it into something positive. And even I imagine coming to a support group and being one of the people who offers the support instead of like and needing support and offering it, it's all part of it. But I just love that the intention behind doing something good with it.
Yeah. I
Um,
always tell my support group, I'm like, you support me as much as I'm supporting you, because they're always like, we're so thankful you started this. It's so great. And I'm like, you guys helped me just as much as I'm helping you. It's such a giving culture.
Yeah,
It's
it's such a
amazing.
beautiful thing. Yeah, it's so awesome. Okay, thank you so much for sharing that. And then and I guess maybe you've already answered this, if there's anything else that you want to share that you do differently in your practice because of your experience, or
Um,
is it pretty much the same?
I would think it's pretty much the same. I think the biggest thing, like in our practice, thankfully, that I was exposed to early on in concussion practice is that vision remediation piece
Mhm.
that not a lot of OTs are trained in or know about, or even patients to do so. And I
Mhm.
think them becoming more of a bigger advocate for that in all areas has been something super helpful because I always say, like, you perceive, say, 70 to 80% of the world through your eyes. And so if that's one area that's messed up, it's 70 to
Mhm.
80% of your body that is not functioning as it should amongst everything else you have going on. So that's super important. And then that interoception piece, as we'll talk about, that is like the foundation. If you are not regulated and you don't understand your body, you're not getting better in any of those other areas as good as you want to. So I think that's kind of how I would say it mostly influenced my practice by using those two um, pretty like significant approaches for good. So like there's a lot of other things. We have sleep and we have cognition and all of this other deficits that we experience, but mostly taking those two things and saying this is where we need to start because for my experience, like those are two specialty areas we have at our practice. So I want to be able to offer that and really hit that home.
Mhm. Awesome. Okay, yes, thank you. That vision piece is so key, and it's so interesting how many people don't realize that it's an issue. Like
Right.
especially like after being like it because the brain is so good at compensating and it is like priority it's very high priority to be able to see and interact with your world through your sight like vision, and so it does um it gets the energy and then it takes away from everything else, and that's why they part of why people feel so exhausted and all of the symptoms and stuff.
Yep.
So it is getting that working properly really does make a huge difference. And I appreciate that you
Absolutely.
bring that up. So thank you.
Yeah.
But today we're going to focus in on interoception, and I'm so excited because I've this topic has been brought up on the podcast before, but I've never like dived into it with anybody, and so I do think it's such an important conversation for people to hear and really important information. So why don't we start with having you define it for us for our
Yeah.
listeners?
Yeah.
What the heck is interoception?
Yeah, so I love it. Coolest thing ever. It's considered our eighth sensory system. So essentially, it's internally knowing how our body feels. So it kind of helps us to notice and then interpret and then respond to internal sensations. So I always like to use the phrase that it helps us feel our feels, right? And so when I said it was our eighth sensory system, we know we have like our internal and external senses. So we have like sight, smell, touch, taste, all those good ones. And then internally, we have our proprioception, our vestibular system, and then we have our interoception, right? So interoception is one of those internal senses that allow us to understand how our body feels. So I also like to call it like our internal dashboard, right?
Yeah.
So the best way I kind of describe it in terms of an example, my elevator speech here, is if one of us or any of you listeners were to have a feeling in your stomach, right? So whether that's a tight stomach or an empty stomach or a crampy stomach, we typically could identify what that feeling is and understand what emotion that might equate to, right? So then I would be able to know, is it because I'm hungry? Is it because I'm full? Is it because I'm cramping? Is it because I'm getting sick? Like, right? We can kind of understand what that sensation is, what emotion that might lead to, and then what do we do about it, right? So if I'm hungry, I'm ideally would eat. So we're kind of looking at the action in terms of that piece when we finally understand how our body feels connected to an emotion and then kind of create an action based off of it. And I'll get into this a little bit more later too. But essentially what research has been showing is that anytime we experience trauma, our interoceptive system is the first sense that we turn off. And that's because we're experiencing trauma. We're in this fight, flight, or freeze reaction. And we don't care how our body feels. Like, forget that my stomach is growling. I need to survive right now. And that's kind of what we find then with brain injury. I'll give a little background kind of on interoception, if that's okay, just because it's kind of interesting to see where it's come from and how it's grown. So interoception started in the early 1900s. So really not that long ago when you think about it, which is kind of interesting.
Just like our understanding of it, you mean, right?
Yes, correct.
Okay. Yes.
Yep. And that was first coined even by this man named Sir Charles Sherrington. So that's where he kind of came up with this word interoception. And he kind of just wrote some papers and some words on it, like maybe knowing how the inner state of your body feels. He was a neuropsychologist, so looked at it from that perspective, and a Nobel Prize winner in terms of interoception as well. So that was kind of neat. But then after that, we didn't really talk about it for like 90 years. Nothing was really done research-wise or talked about it until this incredible man, named A.D. Budd Craig. He started doing all of these cool pathways, studies on these pathways that talked about, okay, it's from the tissues to the brain, this interoception piece, it's the tissues to the brain. And he kind of showed us that it's more than just an internal feeling, interoception, but more so like the entire condition of our inner body. So he did a lot of incredible research recently in terms of interoception, and we're very, very thankful for him and all of the research that he put forth for that. And
when did you say that was? Sorry. When did he do that research?
That was about late 1900s, early 2000s. So around then. So he published like 2002. A lot of his research has kind of been published here and there, but early 2000s, I would say more so is where a lot of the research is, has come into play and gained popularity, if you would.
Yeah, cool.
And then kind of fast forward to the last 10 years or so, we talked about her earlier, but Dr. Kelly Maller, an occupational therapist, a good friend and colleague of mine, she really became the pioneer of interoception and did lots of research in this area. So she started with the interoception in terms of individuals with autism and their interoceptive experience. So if you think about that, we think about kids who are on the spectrum, live in a traumatic state, right? Constantly for the most part. And so they have poor or unrecognized or inaccurate, say, interoception to begin with. So she started by creating this framework and this curriculum to kind of help improve interoception for this population. Really incredible, lots of great research surrounding it. And she does, I mean, just so much research in varying areas. It's really cool. And with her help then, for the OTs out there that are listening, in 2020, interoception was finally added to the OTPF under like a sensory function title. So very exciting. There was a lot of advocating to get us there, but it was finally added and recognized. So super exciting. And like I said, there's been a lot of published works. outside of that, related to varying topics now. So we have mental health, we have anorexia, we have PTSD, a bunch of different areas now where we're really starting to see this research spurt up in different areas and for different populations. So how interoception works, I'll kind of just give a brief overview. We have these things called interoceptors. And so these interoceptors are in our organs, they're in our joints, they're in our bones, they're in our skin. And these interoceptors take the feelings that our bodies are experiencing. They send that then to the brain stem and the spinal cord, and that's kind of where then the relay station happens, right? So they're just relaying things up. Then we go to the thalamus, and that kind of sorts out all of this information, figures out where it goes. And then we hit the insular cortex or the insula. And so the insula is what we call the interoception area of the brain, right? So the insula then is where all these body signals are integrated. It integrates the signals, then combined with emotions, memories, decision-making, all of those other things that we think about when we think about what's processed in the insula. So when we can then understand our body signals, we can kind of determine how we feel. And that's what then creates that emotion, right? So it's kind of like a math problem, we say, where you're adding up, say, tight fists and a fast heart and blinking eyes and fidgety muscles. We add all of that up, or ideally our interoceptors are sending that to our insula to add up and then create an emotion. So we use this word called interoceptive awareness. And so interoceptive awareness is the ability for you to first notice those body signals, then you connect those body signals to an emotion, then you regulate with some type of action, right? So that can be unconscious, conscious, whatever it might be, but we regulate them. So I'll do a fun little study. Like I always encourage everyone to like think about it now. Try it. How do you know how your body feels right now? So for me, like I always think about being super excited coming and being able to talk about this podcast because I'm such a nerd in this area, right? I love it. So my muscles were a little bit shaky. My heart was beating faster. My skin was a little bit sweatier. I was smiling, so my mouth felt tight. And so I think about all those body signals that my body was giving me. And that's how I knew I was like excited about it. I couldn't wait. I had the butterflies in my stomach, right? But that's different for everybody. And that's the interesting thing about interoception is it's so unique for every person. We can't get a baseline as to what someone's interoception should or could be because it's different for everybody, right? So when we're working with interoception, we're ideally just looking for improvements in function. So how does interoception then impact function? And that's self-regulation, right? So self-regulation is essentially the cornerstone of interoception, right? Or vice versa, I could even say. So you need to have interoception to be able to regulate. One of my favorite books, I don't know if you're familiar, Bethany, The Body Keeps the Score by Van.
Oh, yes, I love that book.
My favorite one. So he has this quote where he talks about interoception, where he says, in order for one to feel in control of their own life, it begins with interoception, our awareness of subtle sensory body feelings. The greater that awareness, the greater our potential to control our lives. Knowing what we feel is the first step to knowing why we might feel that way. And if we're aware of the constant changes in our inner and outer environment, we can mobilize to manage them. So my absolute favorite quote, my favorite book, my favorite quote, I love that he talks about interoception. And so one of the areas that we typically see from a concussion that is impacted is our self-regulation. And that's where interoception kind of comes into play.
Holy cow. Okay. The whole time you're talking, I was like, oh my gosh, this is like putting together so many things. Like I have okay. I'm loving this so much because it really does like I just feel like it's truth, but it's packaged in a way that makes a lot of sense to me. That is like because I've been picking up on through a lot of the study that I've done through the life coaching, like that, the mental aspect of things, and like I've done some training on nervous system regulation and like all it's just all kind of like it all ties in and it's all related. And this just I like the way that you explained it so clearly using this framework. I think it makes so much sense. And I have like a billion questions, but maybe I should just let you keep going. And talk about how it's important in brain injury recovery. Let's go there. Although, like I said, I just have so many things that actually no. First, let me ask you this. So it sounds like the overarching structure is there's the awareness, like we get the awareness from our body. We pay attention to the signals that are being sent
Yep.
up to our brain. And that insular cortex there, that's the place that brings the specific, like helps us become consciously aware of what we're feeling. Is that the place?
It kind of helps us, yeah, to process then like what emotion we might be feeling based on adding all of those signals together. So it's like the scientist of the brain or the mathematician. It's adding in all of those and it's saying, okay, this must be anger, or this must be sadness, or this might be excitement. And it's really incredible, right? Because we think about, like, even I just described being excited, but one little switch from butterflies perhaps to like nauseousness, but the same other body signals to me
Yeah.
would be nervousness, right? So like it's really detailed and like lucrative as to how we're how we're understanding this and what our insula then is doing to be able to figure that out and then be able to have some type of exput or output that allows us to regulate or do something about it.
Yes, yes. And it is so interesting how they can be so related, like so close, and just like one tiny little thing is the difference between anxiety and excitement, right? Like
Yep.
it's
Yep.
so fascinating. I'm curious, I feel like and I guess emotion is key to it, but so it's the awareness of what's happening in the physiologically, like in our body, what
Yep.
it feels like, and then we tie that to an emotion, and then based on that, we take the action, right? Is that
Yep.
what I'm understanding? Um,
Exactly.
why is emotion, why is understanding what the emotion is important?
So for a lot of reasons, when we have some type of emotion, whether it's a positive one, a negative one, a neutral one, our body's goal is always aimed at achieving homeostasis one way or the other. So even if it's like excitement, our body is still trying to achieve homeostasis after that. And our body's trying to achieve homeostasis so that we can maintain a regulated state. And when we're regulated, we can focus, we can attend to things, we can multitask, we can have conversations, we can do other higher level brain tasks that are required when we're regulated and in that homeostatic kind of positioning, for lack of a better word, right? And so understanding our emotion gives us the ability, like I said, whether it's conscious or unconscious. So sometimes our body is working on things to help our heart rate obviously come down without us perhaps needing to deep breathe. So I didn't need to deep breathe before coming in here, but I was excited. So my breathing was heavy. But that was an unconscious decision that my body took to say, hey, Megan, stay regulated. So that's why it's super important so that we can continue to maintain that homeostasis, stay regulated so that we can function in our world essentially.
Excellent. And so with the emotion piece, like once you understand what the emotion is, does there, I guess we're operating all the time, not always conscious of what emotions we're experiencing. So it doesn't necessarily have to be conscious. We're having this awareness coming in, our body is responding, we have this the emotion, then we take actions based on, again, whether it's conscious or not of the emotion that's driving the actions that we take, right?
Absolutely. And there's this term we use also called alexithymia that's out there in the world. And that is essentially having troubles describing and identifying the way you feel. So that is like a diagnosis that you could have alexithymia, right? And it's essentially interoceptive differences. So the root cause of this alexithymia is interoceptive differences. And this has been studied for a little while. And the rates of alexithymia after brain injury can range between 30 and like 60% of people, right? But they're essentially those interoceptive differences. And that's where that kind of comes into play with that emotion. So if we're having trouble describing and identifying the way we feel, we have this alexithymia issue. It's rooted in interoception difficulties. And then we can't regulate. We don't know what to do about it. And we're stuck in this like essentially a fight or flight nervous system pattern where we cannot get out of it. And then it impacts function.
Mhm. Is that something that can be worked on? Can people work on
Absolutely.
their interoception so they get better?
Absolutely.
Okay.
Yeah.
Good. That's what I would have assumed. So let's talk about that for a second. I know, again, if people have experienced trauma, and I think a lot of people have to some degree, especially if you're dealing with post-concussion syndrome, there was some trauma that has happened that has
Yeah.
gotten you to this place, right? And so, um, and what you were saying about this, like tuning out the interoception, like
Yeah.
turning that off, that dissociation, is very common and understandable, and but can be problematic when we stay tuned out. So what can people do if that's been their realities, like they don't probably don't even realize it to some degree that that has been an issue. What can people do about that?
Yeah, so that's kind of like the first step is right, even understanding that interoception is a thing. We get a lot of patients there, what does it look like in function? They're coming to me and they're like, I flipped out on my husband for no reason. I didn't even understand why I was flipping out on him, or I yelled at my boss, or I screamed at my kids, and I don't even know why. And what I go to explain to them is, well, has anyone talked to you about interoception? And they're like, well, inter what? Like, what is that word even? Right. So then I kind of go on to explain to them what I kind of just explained here. And as we know, like trauma doesn't have a preference. So it can be an acute trauma, it can be chronic trauma, it can be something as silly as not silly per se, but witnessing something that put your body right into this fight or flight, or being in a terrible car accident or something, right? Varying levels of trauma, but it doesn't have a preference, and it can immediately put you into that fight or flight and turn off your interoception, right? Because you're in fight or flight. You're just trying to survive then. So it can happen to anybody. But typically, as it says in the name, a concussion, right, is a mild traumatic brain injury. And we work with a lot of patients even outside of a concussion, so other types of brain injury, but traumatic is in its name. So we already know it's some type of trauma, right, that has happened. And so when we know that this trauma has turned off our interoception, we're going to demonstrate difficulties in a lot of other areas. And why I was saying earlier is it's kind of a foundation to everything, is because if you're not regulated, you can't participate in doing vision activities. You're not going to be able to participate in cognition activities. You're not going to be being able to participate in work, in school, in sports. Like if you are not regulated, we're not going to be functioning the best we can in any other area of our lives. And so that's why we typically try to tackle this interoception piece as one of the first pieces when our patients come to us, because it is so important. It's the groundwork for every other thing you're going to try to do as you're recovering from your concussion, right? And so what's kind of interesting too is that when we have this concussion, we have difficulties identifying and then regulating those emotions. We see this big, like whether it's a spike or a big dip, things like that, that is just not like you for a person, but now you have a concussion and that's how it is. It's that body again, not being able to create a conscious or unconscious decision on how to act. And so that's where a lot of that foundational research is coming into play with that self-regulation piece. Now, when we kind of look at it in terms of why interoception and brain injury, I did just give like that overview, right? We know when we experience trauma, our interoception turns off. But the other things we have to think about when it comes to interoception and brain injury is a lot of the standard protocols for concussion require interoceptive awareness, right? So our CDC recommendations, whether it's for you as a brain injury survivor or a child, your child perhaps, is if your symptoms get worse during an activity, then that activity should probably be ceased, or you should probably stop that activity. Or if you need to take a break, make it when your symptoms are getting worse, right? Or recovery from a concussion is when your child can do all of their regular activities without experiencing any symptoms. Well, that all requires interoception to know all of those things, right? And so if we have impacted interoception, none of that is happening great. Also, traditional brain injury treatment expects a patient kind of to rely on interoception in terms of like a scale, right? So a lot of times it's like on a scale from 1 to 10. Well, what if you are having trouble identifying the different types and managing the pain or even the comfort, like whatever it might be? And then also like in terms of vision, a lot of patients are asked to like describe what they're seeing, but they don't necessarily have the vocabulary to do so. So a lot of times they describe, or they might rely on interoception to be like, I feel the strain, or I feel the pulling, and that maybe that indicates you're converging, or maybe that indicates something single versus double, or whatever it is. And so we've come a really far way from the traditional cocoon therapy or just like the rest for individuals. But as we know, there's no true benefit that indicates that. So the new treatments are targeting these symptoms. But again, we go back to that protocol targeting symptoms requires interoception. And if we are struggling with interoception, we're struggling to begin with to even identify that and then do anything about it. The other thing I kind of talk about in terms of too with protocols is they're usually asked what type of pain or fatigue, like I mentioned before, or they're asked like, how does this activity feel after or before? And as therapists, we do that all the time, right? We need to we need to know, we use that to manage, but there is no consideration for that person's current interoceptive ability. So that's what I kind of always had struggled with too. And this is something that I personally struggled with myself. I am not typically like an angry person at all, but I would find myself like snapping at my little 5-pound dog for no reason. And I'm like, what the heck? He's the cutest thing ever. He's not even doing anything wrong. Like, what is wrong with me? And then I'd get really upset over that and I'd start crying, and I'm not a crier. And I'm like, okay, this is so weird. And I did try a few different treatment ideas and different people, psychologists, things like that. And just nothing seemed for me personally to be working as I had hoped or how I wanted it to. And so I already knew about this foundation of interoception and had been integrating it like here and there, never on like more of a formal basis per se. And so something needed to be done. I was like, all right, well, this is ridiculous because I can't figure out, I can't regulate. I need to be able to regulate and, to work and to function and do. And so that is when I kind of did some brainstorming with Kelly, and I created this idea of an adapted version of her curriculum for individuals on the spectrum specific to brain injury. So that's kind of where we came about doing all of this, because we need it. It's not something that's addressed. What I would find is, like I had mentioned, going to different doctors or therapists before, is a lot of times, for my personal experience, they would say things like, okay, well, try deep breathing if you're feeling anxious. Well, how do I know if it's anxiousness or anger, or if I'm even excited? Because I can't even differentiate that sometimes unless it's so strong that it's like in your face. And then B, I would try the deep breathing and it wouldn't work and I would hate it. And I'd be like, what the heck is going on? I hate deep breathing. But that's the whole idea behind interoception, right? It's like so different for everyone. So through all this work, independently doing it in my recovery and looking through research and spending tons and tons of time diving into all of this, well, for me, deep breathing actually increases my heart rate. I don't like to deep breathe. That's just how I am. My brain goes a million miles an hour. I feel my brain racing. I feel my heart rate actually getting higher. I feel my muscles getting tenser when I personally try to deep breathe. It just does not work for me, which is fine, right? It's different for everybody. I also hate running, but if I can identify being anxious and I go for a run, I feel better. My heart rate decreases, my muscles become less tight, and I hate running. And I never would have known that though, unless I had worked through interoception. So that's the really neat part too. And where OTs can thrive at this is it's so individualized, right? And that's what we're all about for OT, is like individualized care. It's awesome.
Yes, very cool. So tell us more about your experience with it. If like as you were having this kind of emotional dysregulation, not sure what was going on, and tying that back to not understanding what was happening in like the interoception piece. What how did you apply what you were researching and figuring out, and how did it help?
Yeah. So after I kind of went through all this research and my independent, excuse me, studies and experiences with it, I took the curriculum and I started changing it for brain injury and what these brain injury patients were experiencing and what I knew I was experiencing. So long story short, this is all part of my doctorate degree too. This was like my final thesis and everything is part of my doctorate degree when I decided to go back to school.
Cool.
And we created a curriculum, a step-by-step kind of guide, a framework on how to help people improve interoception. So through Kelly Maller, because she is the interoception guru. And like I said, I'm so thankful to be her friend and colleague. We worked to publish this course on interoception with all of the materials that therapists, and even it can be caregivers, it can even be yourself, it can be other healthcare professionals. And while I say OTs are the experts at it, just because we have such a good grasp on the sensory system to begin with, which, as we know, it's a sensation, it's one of our senses. It's meant for anyone to be able to use and kind of walk yourself through it if need be, or to work with caregivers, friends, family, from a speech therapist point of view, from a therapist point of view. I know people all around the country in different professions who are using it and integrating it, and it's incredible. And I absolutely love it. So that's kind of what we put together. So the course is, I want to say, over like 100 pages worth of materials that you can either, like I said, do yourself, or as a therapist, kind of do it can be flexible, but 6 to even more week kind of curriculum that you're going through with your patients to ideally improve interoception.
Awesome. So how did it work for you?
Tremendously. I loved it. That is honestly how I figured out that if someone tells me to deep breathe when I am angry or if I'm anxious, oh, you're ticking me off even more and I'm getting even more anxious. Like that is how I figured it out. Before I would just keep trying to quote unquote push through it and say it should be helping. It should be helping. It's just deep breathing. You're just calming down. And it didn't work. And so I found what worked for me. I found at what point I needed to stop with my symptoms if I was going to be able to get to work tomorrow. So I'd do a full day of treating and then I'd give myself my own therapy after. And I could then finally manage like at what point was I doing enough therapy where I knew it was helping. But if I did any more, I would have to call off work tomorrow because I would be in a migraine, miserable, like not getting out of bed. Right. So I could then finally manage like how much I could do, how much activity tolerance I had, and things like that. So that was extremely helpful. And then also, it is helpful, and it was helpful for me in helping like medical professionals diagnose and understand what you're going through. So a lot of times, we have word finding difficulties after a concussion or processing speed difficulties. But as we work through this program, which I'll describe a little bit later, kind of how it's broken down and what it looks like. But as you're going through it, you're given vocabulary to talk about it and to understand. And so what then I had learned through going through this myself and asking the other doctors and nurse practitioners and nurses and optometrists and every other type of professional out there is they were like, it's helping me. Your patients that you're working with are able to tell me, maybe not that they're seeing double, but they're telling me, oh, my eyes feel cloudy and they're strained. And then they're saying, okay, now I know I can tell them, well, does it look double? Does it look like this? Oh, yeah, that's it. So people weren't necessarily using double or blurry, but they could describe it. And it was helping the medical professionals 10 times more in addressing specifically what they needed. And that all started when I was describing to my doctors kind of some of the symptoms that were going on that I could feel and identify, but I couldn't necessarily put into words. And they were like, wow, this is so helpful. So that's another kind of area it helped me, which is really interesting. And we don't think about that.
Yes. Oh, it's brilliant. I love it so much. I feel like this could be so helpful for so many people in so many ways, just across the board.
Yeah.
And again, it is putting it a lot of what I'm doing right now, I feel like is perfectly aligned with this as far as my coaching and like understanding the
Yeah.
nervous system. Like it's exactly this, but this is I love the way that you're structuring it and the key component. I think that understanding what is happening within us is you're right. It's key to being able to understand what to do next, right? Like
Yes.
we're just like floating through completely unaware, then we're not awareness is the first step in any change that we want to make. And so yes, including healing and progress towards recovery. So I do really appreciate this perspective and am interested in hearing more specifically about like what kinds of, well, I guess maybe to go along with what you were sharing before about how you would like just find yourself enraged at your cute little puppy, your little dog, right? Like I think this is something that people can relate to, and not being able to, not understanding why that was, or
Right.
just all of those things. Like, what about understand, like, what was it that you were able to understand that allowed you to work through this? Like, actually, did it get to a point where you understood what was going on within you to prevent you from getting to that point where you were exploding at your dog, or was it that you just understood what was happening and so you could redirect that emotion to something else, or maybe it was a combination? What was it like?
No, more so the second point. Like I would get to the point where I'd be freaking out. And thankfully, like through I was telling you about my supportive family and friends and stuff, like they would be like, this is not you. Like this is just not you. You are not, you are such a like level-headed, calm, happy person. Like this is just very unlike you. And I knew it too.
Hmm.
And you know, there's a fine line between it being validating and it being like, I know. For me, it was validating. And it kind of then pushed me into saying, okay, I'm recognizing all these crazy things and I'm freaking out at my dog. And then I'd sit there and be like, okay, hold on a second. This is not right. And I'd be able to like redirect my thoughts. But then that's when I started to really, I think it was like one day I remember like sitting on the couch and my poor dog sitting there like looking at me and I'm like, oh my God, I'm like, what is going on? And so then like I started to feel my eyes swell up because I felt bad and I felt my heart like almost it hurt, like it genuinely hurt. I could feel my heart hurting. And so I started saying to my husband, like, I feel these body signals. Like I feel my body changing. Like what is going on? And so then I'm like, oh my gosh, Megan, that's interoception. He was like, yeah, isn't this what you do like all the time? Isn't what you do all day? And I'm like, oh my God, you're right. Yes, 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 yes. And so that's what then kind of like led me down this pathway of like, how, why, what is the research behind it? And there's still limited research in the area, very, very limited research in terms of how it impacts people with traumatic brain injuries and specifically concussions. And then even a route to take for that. And because I, prior to kind of that aha moment, had tried other therapies and nothing was working, I knew there was like some type of missing piece. And then once I could work through that, then like say the suggestions that therapists were saying could have like, I just personally had stopped because I had figured all this out and like did it on my own. But like, hey, if I had an underlying foundation of interoception, everything else every other professional was helping me do would have been 10 times better. Like, now that I understand how my body feels.
Yes.
So that's kind of the pathway that I took. It was just one day I had that aha moment and I was like, yeah, and everyone needs this. And then I'd go into work and be like, so I know we've been working on interoception like sporadically, but like, do you feel like it's helping? Because, I would ask and the people would be like, yeah. And I would say, because I'm experiencing and I'm very open, I would share it with them, and they'd be like, oh, this has like changed my life. Like, this is not just like oh yeah, it's helping. Like, you don't understand. Like, this is incredible. Like, I'm like, holy crow, wow. So that's what kind of then also gave me that like aha moment to like, we need to do something about this so it's accessible to like anyone and everyone, especially for people who have like the deep understanding, like OTs, on how to kind of move through that.
Very cool. So go ahead. Let's tell us about it. I want to hear more about the course and how it's structured and all the things.
Yeah, so it's I believe it's a 2-hour course online. So I'm sure Bethany, you can post the link if that's okay for however you do for people to see. So it's a course you can take, and there's 2 hours worth of educational material. So describing it all, how we do it, why we do it, the background behind everything, a lot of what we kind of chatted about today here, just on a deeper level with Kelly, who is the guru of interoception. She is so incredible and super supportive of everything too, like loves the idea of interoception moving into different areas. She is just wonderful. And so it's her and I kind of going back and forth, talking about that. And then we say, all right, well, here is how we implement the curriculum. Here's what you're going to do. And without going through the whole thing, I'll kind of give you just like a breakdown of what it looks like. So there's 3 different sections. So kind of what I was describing to you as interoceptive awareness, it's first noticing your body signals. So the first section is taking your body signals and identifying them, going through different body parts, understanding how your hands can feel, how your eyes can feel, how your feet, your heart, essentially drawing that awareness to that body part so that you're genuinely building that skill. Like if I hold my fists tight like this and I think to myself, and I'm very mindful of this is what a tight fist feels like. Okay, this is my tight fist. Yes, tight fist. I feel it. Okay. Ideally, you've now built that pathway from the interoceptors in your muscles, your bone, your skin, everything in your hands back to your insula. So the next time perhaps that I was getting angry, I would start to feel that buildup of tight hands because I had built that pathway already before it was to the point where I was like, ow, I'm like bleeding from like my nail sticking in my hand or something like that, right? So you're building that awareness rooted in mindfulness. You're building that awareness for all of those body parts. Then we jump onto the second section, and that is emotion. So it's that math problem that I was telling you about, tying together all of the ways your body parts can feel into an emotion. Understanding that there's varying intensities of emotions as well, right? We talked about that with the pain scale. There's different pain scales, but that's the same for every emotion. If I just say I'm feeling sad, there's 100 different ways that sad can be and feel. So if I'm at the high end of sad, perhaps I'm feeling depressed. That's a lot different than just feeling sad, or even lower than that on the scale, like just feeling like meh. Like that's my favorite word to use with my patients. Like, that's the word I've been looking for, just meh. I'm not really sad, and it's a different body signal that you're getting than sad or depressed, right? So we kind of go through it in terms of that. And then we work through creating a kind of an outline of what it looks like for everybody, and not so that they can go back and look at it and say, oh, I'm feeling X, Y, and Z, so I must be this emotion. Well, and don't get me wrong, some people do that and it's really helpful, but it's more so, again, just building that mindfulness and awareness behind it. And then the third part of that is action. So now we've identified how our body feels, what emotion that is, what can we do about it? And this is where you'll love it, because this is all about the nervous system. So from a brain injury perspective, what makes us very unique is majority of the actions that we suggest are rooted in vagus nerve strategies to help, excuse me, regulate our bodies, bring it back into that rest and digest over that fight, flight, or excuse me, freeze reaction. And those, those research studies in terms of these different cold water and things like that that have been done are rooted in years of research, right? We know the autonomic nervous system, right? It's incredible. And so a lot of those strategies that you're given are provided from that research based. But ideally, by the time you now get to this action part of things, when we trial, whether it's in session or not, whether we're trialing, when we're trying activity, we can understand, is this changing the way my body feels for the good, for the comfortable, or maybe for the bad, for the uncomfortable? And we're learning and we're creating a personalized toolbox for us for things to do and use that A, we know are rooted in science, but B, sometimes just feel good. So I always joke, like, I love stepping on crunchy leaves. Like, it makes my body so relaxed and so calm. And so if I feel like I've had a long day at work or an emotional day and I'm just overwhelmed, it's the silliest thing ever, but I go outside and if I step on leaves in the fall, I am automatically feeling 100% better. And I feel it, right? Like my heart rate slows. I've got looser muscles. My eyes aren't as squinty. I just feel good. So it's kind of coming up with a list of those personal things you love, but also you're guided through, I believe it's like 18 different topics, whether it's deep pressure, whether it's visual, whether it's auditory, as to how we can help the body and change the way the body feels. And that's why OTs also are really unique in it, because I work with them with a lot of my patients through like their sensory processing system and things like that. Like I have a good grasp on that before we go through this. So kind of have an idea what that would look like as well. And so it's really fun. That's my favorite part of the whole curriculum, getting to do this and patients trying things that they never thought they would try. And I'm like, just give it a whirl. It might work. And then if it ends up, working, everyone's like, oh my gosh, I wish I did this. No one ever told me. Or we also find that people will say like, well, why don't we just do these things right off the bat? Well, it's the same reason for me. If I'm just telling you to do something, but you're not understanding how it changes your body, you're never going to know if that strategy is helping you essentially achieve, right, that homeostasis again and change the way your body feels.
Yeah. Yeah. Awesome. Again, this is just like, it really fits into so much of what I am doing and like I have seen be very effective for people. Like this is what I'm doing, but it's different words to put to it, I think. And I think it's really cool because I know I know this will be helpful. I know this is helpful. I just am curious. We're getting low on time here, which is tragic because I could talk to you all day and maybe we'll need to like bring you back on again. But is there any people that you would say should not do this or where it's contraindicated? Because I know that for some people, especially if like extreme trauma, it can be very triggering or very problematic to try to like get into their body. And like, I don't know, just I know psychologists might be saying, hey, be careful with this. Like, is there anything that any hesitations that you have in this?
Yeah, absolutely. Tread lightly, right? It is a deep topic. It seems so light, but it really is a deep topic to start to think about. And especially if you've been through several traumatic experiences, right? Like you've turned off your interoception for how long? So this can lead to a flood of emotions or feelings coming back that you haven't had in a really long time. So I always caution my patients beforehand. We do almost like 2 full sessions on educating them. And then as an OT, you can also like upgrade and downgrade things, right? So if I know this might be tough for a patient, I'm starting with just something as simple as hot and cold hands. And that's it. And we're starting there and we're taking it really, really slow. There's some people where maybe they're just not at the point in their recovery where they're, I don't want to say willing to let it work, but sometimes we're so guarded that we're just not ready for something like that, right? So there are 100% are those times, but the best part about it is it's all kind of self-paced and self-led. You can stop at any time. We're not talking any type of medication or physical thing that we're doing. It has nothing to do, right, with any of that. And so it can be stopped at any time. And we don't need to be too worried about anything dramatically happening like that. But with that being said, again, we tread lightly. for me too, like a lot of the patients we've been seeing, it's post-concussion syndrome, right? So they've been having these symptoms for years and years. So oftentimes when I suggest that, they're like, I will try anything, like literally give it to me because I've been this way for so long. So they're willing to do it. So I personally don't run into that too often, but we definitely do caution people to take it slow and work at everybody's pace, because pre-concussion too, we never know what somebody's interoceptive abilities were before that.
Yeah, true. True. And I think that, yeah, just like establishing that safety within the body through it, like yeah, it's important to have that, like as people are doing this, like to pay attention to their body, how they're feeling. This is the whole point of it, right? And to recognize, okay, like go slowly, go at a pace that feels right. And yeah, don't push towards out of safety. Because again, that was a protective measure that the body took and the brain took to
for a reason.
First place. Yeah. So to love yourself through that and be patient with yourself through it. Just yeah.
Perfectly said.
See that. All right. Well, thank you so much for bringing my awareness to this. This is so cool. I would love to have you, let people know how they can hear more from you or get in touch or do your course, all the things.
Yeah, absolutely. I'm sure you'll post a lot of information, and for any OTs too that are interested in kind of furthering their knowledge in the concussion realm, including interoception, but a lot of other areas, including vision and trauma and things like that. I also co-own a consulting company called NeurOT Consulting, and we kind of train rehab professionals and teams, OTs, PTs, you name it, on how to kind of do more of that holistic approach in terms of that too. So interoception, of course, is included because that's the foundation, as we've discussed today. But just wanted to throw that out there for anybody interested in too, because I know as an OT early in my career, I was always looking for more education in a deeper field. So that's why we kind of also created this consulting company to help people, because OTs want to learn.
We do. We do. Awesome. So I will put the links in for the NeurOT Consulting. And what is the name of your the course that people could take?
It's that one, the interoception, brain injury, and concussion, on Kelly Maller's website.
Okay. Awesome.
So I'll give that one to you too. So
put that in there. And do you have like an email address, or is it just through your website? What's the best place if people wanted to contact you?
My website is NeuroMegan, and you can contact me then through that website too. I also have a Facebook page where I like to post some fun and cool ideas, and that's NeuroMegan as well. So you can look that up and contact me through that as well. And I can leave my email address for you too, Bethany, so you can leave that posted wherever you do for people. Feel free to reach out. I love talking to people, whether it's professionals, patients, you name it. I love talking to people. So please feel free to reach out, even if you just want to chat. I'm more than happy to.
Fantastic. All right. Well, thank you so much for being here. Thanks for sharing this and the good work you were doing in this space. It's awesome.
Absolutely. Thank you for having me.
I'm so glad you listened in today. I hope you have gained some helpful insights and inspiration regarding dealing with and recovering from concussions. My goal is to create more awareness and education about concussions and the fact that there is so much that can be done to improve life after someone has had one. Help me spread the message by liking, commenting, rating, and subscribing to this podcast, and share it with others who would benefit from hearing it. There are more resources available on my website. And again, if you or someone you love would benefit from concussion coaching, sign up for a free consultation using the link in the show notes or at my website, www.theconcussioncoach.com. Thank you. See you next time, and take good care of that amazing brain of yours.